In multiple myeloma, we clearly are getting patients who are treated with the triple main classes of drugs in the newly diagnosed setting, and patients can become refractory to these therapies within 2 to 3 years from diagnosis. Often these patients were not salvageable, but we now have BCMA targeted, GPRC5D targeted, and soon FCRH5 targeted medications. A lot of these medications are now available in routine clinical practice, and they're now also being combined with other standard of care agents to improve outcomes. And this is what excites me, because it provides greater opportunity for us to treat patients, potentially personalized care for patients, which will improve survival. But we should continue to strive to diagnose patients early and treat patients early and put them in deep remissions for longer periods of time. And hopefully, with all these new drug assets we have, we can start to shift them more to earlier treatment setting and improve outcomes for patients.